Welcome back to In the Know. We're talking all about oral hygiene with Anaida Deti from DentalX. So let's talk some more about flossing, everyone's favorite thing to do. I want to debunk our first myth of the day. Are you supposed to floss or not floss? Because some people say, you don't really have to floss.
You definitely have to floss. As I usually explain it to our patients, we say teeth have 5 surfaces. So let's say if this is a huge tooth, you have 1, 2, 3, 4, and 5. So there are 5 surfaces. By brushing, we actually can remove plaque from 3 surfaces, 1, 2, and the grinding surface. So let's say if you put your hand into a coffee or whatever, something that is colorful, and you put it out, you just clean all the way, all surfaces, and then you open up, you're going to see all the stuff in between. Right. So that's where the flossing gets to, where the brush cannot. So it's very important to floss at least once a day before you go to sleep.
Okay. So you're an ambassador with the Ontario Dental Hygienist Association.
Yes.
And so I'm sure you teach lots of people all the different stages of oral care.
Yes.
As we mentioned, we have young kids, but dental hygiene goes right through until your senior ages, right?
Of course, because now the people can retain their teeth till they are 80, 90. The oldest patient I have is 97.
Wow.
And he still has his own teeth. And that's amazing when you see that, because people are taking more care now of themselves and their diet is much better. So they know more with everything that we have. So definitely people are retaining their teeth. So it is very important to know how to take care of their teeth when you are so young till you grow older.
Okay, so let's talk about that. Let's start with babies and infants. How to take care of baby teeth and toddler teeth.
It is
right from the get-go.
Exactly. So it's very important, and one of the questions that we usually get is like, is it important to fix the baby teeth? They're just baby teeth. They're
going to fall out anyway.
It is very important to take care of the baby teeth, and I usually say it is probably as important as taking care of the adult teeth, because they keep the spaces for the permanent teeth, and also if they get an abscess on the baby tooth, and if it's too severe, it's going to affect the permanent teeth. So it is very important to take care since they have the first tooth till they lose all of their baby teeth. So when, as soon as the baby has the first tooth, that's when you should start brushing the baby's teeth.
Okay, and do you brush with like a finger brusher?
With a finger brush or a very small toothbrush. We have toothbrushes now that they are different stages. It's the first, second, and third stage. And the first stage is a very small toothbrush with probably no toothpaste for the babies, and just with water, just to brush it a little bit. It's a great thing to do when they are babies. And also, their first dental checkup should be probably by when they are 1 to 1.5 years old. It's very good to have them coming to the dental office just for a quick checkup. It's nothing really going to happen that day. It's a good thing if they just come in, see the place, know the people, and it's amazing because they can go a long way from there.
And make it a fun experience. I know
Definitely.
When we brought Isabel, my eldest, to the dentist, it was like, we're going to the dentist. It was this big thing. We went, and she got to pick a toy out of the treasure chest.
Sure.
And so now every time she asks, when do I get to go to the dentist again? Because she knows every time she goes, she gets a new toothbrush and toothpaste and a treat of some sort.
And it's very funny that you say that, because actually my preference is to see more kids than adults, especially my generation. Especially because I was also in a different country. We used to go to the dentist only when something was hurting. So going to the dentist was a terrifying experience. And most of the people that I see, patients that are adults or they are my age or older, it's a terrifying experience still, because they went to the dentist only when something was hurting. And that's why seeing kids nowadays that they're so happy to come in, it's great to see. And it's something very, it gives us actually a big pleasure.
Okay, so they're kids, they're great, and then they kind of hit puberty and their teeth get all wonky, and they might need braces or retainers, or they don't do headgears anymore, right?
Very rare, very rare.
Child of the 80s.
Very rare now, but they still do. The thing is that when they are teens is probably the worst stage, because as you said, they go through puberty, they have the braces, the orthodontic work, also wisdom teeth are coming in at that time. So it's actually quite a lot of things going on. And that stage is also because the parents are not brushing your teeth anymore, and they are not really taking care of your teeth anymore, but is yourself that you have have to start taking care of your own teeth. And that's why I say to the parents, when you have a teenager, the best thing to do is to bring them a little bit more often to the dental professional, so they can, if there is anything going on at that stage, you can actually get it earlier instead of becoming a bigger problem.
So when you say a little bit more often, like every 6 months or more often than that?
More often. Minimum is every 6 months. Babies have to be seen every 6 months. When you're teens, and I say a little bit more often, it's usually every 3 to 4 months.
Okay. And if you have orthodontic work, of course, you're there
all
like
the time.
every other week
to
get tightened or loosened or adjusted or
yes.
or something. Okay. So now we're getting even older and into
Yes.
our adult life.
Yes.
And more things are going on in our teeth. What's happening with our mouth?
The thing is, when you become a little bit older, and I usually like to say the word mature, when we get a little mature is usually there is some stuff that is going on, especially we get like medical conditions and a lot of medications, and that's when we see that also patients have more problems than they used to when they were a little bit younger, because all the stuff that is going on, it's going to affect the mouth, no question. And one thing that I really like to tell them when they are at that age, I say it's like the grandma's recipes. So I usually like to say, a little bit salt water, because if you see here, something is missing, and it's not because I forgot, it's on purpose. So there is a mouth rinse missing. And I usually say, if you have to rinse your mouth, probably just use a little bit salt water, and that's very cheap, easy to do, and
Instead of a mouthwash.
Exactly.
Okay.
I usually like
more
to
of a
say
natural mineral rinse.
Exactly.
Okay.
It's very important.
Let's do another myth debunker. Does your saliva change as you get older and your hormones change?
So that's I usually say it's a myth when you say things change, unless you are taking medications. If you have any medical condition, that's a very different thing. But generally, it doesn't change. It's just if you have, like let's say if you want, like you just slack a little bit on brushing and flossing, that's when things change in the mouth. But it's not really changing anything in your system unless there is a medical condition.
What about if you're pregnant? Does that count as a medical condition? Do your teeth change when you're pregnant? I was told that.
Yes, teeth don't change. You might get, it's called some pregnancy gingivitis, that your teeth, you get some more bleeding because of the hormones. That's why you have to brush and floss a little bit more and maybe have cleanings a little bit more often, and then should be the same as a person that is not pregnant.
Okay, we have to take a short break. When we come back, we're going to talk about caring. We're going to go to that last stage of seniors care for your dental care and your teeth. Don't go anywhere. More coming up after the break.